Well, joining me is Kate Beecroft, and we've got to do a couple with you actually today, but the first one on our list is to do with the consultants. Up at Nobles Hospital, the question went in, because it is only written questions at the moment, and well, over to you, the figure that came back on what the consultants are getting, you're not happy about it, I'm taking it.
Well, there's quite a lot I'm not happy about health actually, because by coincidence, Stuart tabled his question about the payment to consultants at the same time as I tabled some other ones. So if I can just go through, run through the questions.
Remind me, because I remember the one about the money, because that stood out.
That stands out, yeah. But when you look at that one about with Duans, the sort of highlights for me was comparing it to payments in the UK, which we've never been very good at benchmarking and things like that on the island.
But it came
as we should do.
£100,000 extra.
Yeah, but when you look at the percentages, you look at 16-17 was 74% more.
74%, okay.
Yeah, 17-18 is 75.8% more, and the first quarter of 18-19 is 89.1% more than the average in the UK. Now that's for the top 10.
Right.
Yeah. So I mean that's only they haven't finished doing the analysis, I would suggest, at the moment, because obviously there could be some reasons for that. But it seems an awful lot to me some of them when you compare what we're paying to the length of our waiting lists, for instance.
Well, aren't they saying they're having to do is to get the waiting list down, though, isn't it? I mean, they're taking on more consultants to deal with the waiting list?
Well, they're taking on more consultants so that we don't have to employ locums as well. Right. Because the locums cost an awful lot of money. So if you can get somebody into a substantive post, you save money. But when you look at the top three, if you think the target in the UK is 18 weeks from the time that you're referred to the time that you're treated. That's the target in the UK. And I'm not saying it's always met, but that's what's expected. Now, if you look at because three of the consultants didn't have clinics as such, because they weren't, I think, the pathologists, I think the question said. Right. So they don't have waiting lists as such, so you can't measure that. Right. But if you look at the worst three of the others, bearing in mind the 18 weeks or 126 days of waiting, the average time for just the first appointment here is between 291 and 470 days. Okay, but and hang on, the maximum waiting for just for the first appointment is between 1,051 and 1,570 days, compared to what's expected as 126 days from the UK. And we're paying all this money.
But you were in health, when you were the Minister of Health, was this not an issue then? Did you not know these numbers then?
No, I didn't know these numbers then.
Why did you not know these numbers? Were they different, do you think, then, or was it just something you didn't get to grips with, or weren't told, or what?
I certainly wasn't told. I don't know if management were even aware of this, because I tell you what, since we've got a new hospitals manager, or hospitals director, whatever the title is, I'm not very good at titles, as you know, and a new medical director, it would seem to me that there's quite a lot that's coming out, that they're asking the right questions, they're following the right things to find out, because they're number crunching and they're saying this is what's happening. So
are we paying too much for consultants, and if so, why? And if, is it lack of management that's keeping our waiting list so big, or do we need more people?
That's what the department has got to answer, isn't it? I mean, as you said, I'm not in there. I got sacked, so I don't know. Yes. But I'm certainly asking questions. And certainly when you look at just that, where are we for the... I can't even find my bit of paper now. But it's about the annual leave. Oh yes, there it is. A consultant's entitled to 32 days annual leave, and they can carry forward a maximum of 5. So that's 37
over
days.
6 weeks, isn't it? Yeah, right.
Yeah. So this translates in hourly times to between 256, which is basic, or if you carry over your extra 5 days, that's 296 hours. Now it's suggesting that, and I want to get this right, this is why I'm looking at my notes, because I don't want to put any misinformation out there, but it is all in the written answer anyway. The 4 consultants have received annual leave totalling 1,112 hours, with individual hours ranging from 464 hours to 40 hours. So how can a consultant claim 464 hours when the maximum should only be 296?
I presume you're answering all these questions. You're going to put these forward yourself?
Well, I'm sure June will be.
Well, he's
I'm
yeah.
just sort of tying it in with my questions, if you like, because it just raises more and more questions about health. Because as you know, I've been concerned about health for a long time.
Yes.
And being minister certainly didn't alleviate my concerns.
Is it a management issue? Are you alluding to this? It's bad management up there.
Well, what else can it be?
Well, that's what I'm asking. I mean,
I mean,
the consultants are doing what they do, and they're working to the hours they're meant to work, and they're getting paid what they've been given, right? So,
we don't know.
No,
we don't know, and that's why you say you'd need it on an individual basis. But this is where management should be coming in, and I'm not just talking hospital management, because I say the new director of hospitals is doing an excellent job and is getting to the bottom of these things. But prior, the directors or hospital managers or whatever their title was at that time, why haven't they been on the ball with these things?
So David Ashford,
why hasn't the chief executive been on the ball with these things? Why hasn't he been asking the questions?
How's your relationship there? I mean, do you speak to them directly, or would you just go through David Ashford to find out the answers for this, or just put a table of question about health?
A table of question. I like it in Hansard.
Yeah.
Because otherwise, this is no reflection on David whatsoever. David Ashford, I think he's doing a pretty good job in there, to be honest. But I like things in Hansard so that you've got it there.
And the answer in your case here would be the management has to change. Go change the way.
No, I'm saying you've got to have a good look at it, find out exactly what's happening. Got to, because if you tie it in, then there's never one single thing. If you tie it into, and this really does concern me. There's several things. This is answer 56, and it was about the review of theatres. Now, they identified potential efficiency gains of approximately £3.5 million. So again, why haven't those efficiency gains been found earlier? What has management been doing in previous years that this hasn't been picked up? But more concerning, and money is one thing, but quality is definitely another, where you've got lack of quality assurance processes, lack of training, support and opportunities, absence of clear accountabilities for theatre performance and procedures, lack of published metrics, standards, benchmarking relating to performance. I mean, it's all in the answer. And to me, it's just...
And again, this would all...
No clear team vision.
But this would all be going on when you were there as well. But you didn't know about any of this when you were health minister?
Listen, I tackled a lot of issues while I was in there. And I'd have tackled an awful lot more had I been allowed to stay.
Right. Well...
And I made some changes in that, which I will come to in one of the other questions, if I may.
Okay, carry on.
Because that does relate to when I was in there. From 2016... This is April 2016, the lack of an antimicrobial specialist pharmacist and therefore risk of patient safety has been on this list since April 2016. Now, I made a ministerial decision in August 2017 that patient safety was always my top priority. And there was two, I was shocked when I saw the risk register, I'll be honest, it was disgraceful. And there was two positions there that, and the MRI demand, outstripping capacity results in long waiting lists, that was on since January 15. Those two things, one cost 60,000 to put right, one cost 70,000 to put right. And they hadn't been acted on.
But you were attempting to do that at the time, were you?
I made a ministry, in the departmental meeting in the August, I went round the table and I said, does everybody agree that these two items particularly have to be acted on now? Everybody agreed. Okay. So I made a ministerial decision right then that they had to be actioned.
And that hasn't been done. Okay.
I found out that several months later that one of them certainly hadn't been actioned because they said the budget hadn't been found for it. And yet nobody had come to me and said, this hasn't been actioned. Now, one of them, we'd actually been criticised in a coroner's report.
Right.
You know, you cannot just... you cannot have officers, when you've made a ministerial decision, you cannot have officers just ignoring it.
So this is,
without you even knowing it.
But this has all suddenly come up in answers to questions, right? You're getting all this information suddenly now.
Well, obviously I saw the risk register, which is why I said about these two items that they had to be done.
Okay.
Again, there's another one on 2016 about lack of ward pharmacists, which again I thought had been sorted. 2012, failure to plan. Again, I thought that had been sorted. Strategic risks. Registration and inspection standards are not fully met in the DHSC facilities. So they're not meeting their own regulations. Community care, inability to comply with Regulation of Care Act. I mean, I'm sorry, it just goes on too much.
It does. It makes it sound like, I mean, should people be worried then? I mean, really seriously worried about what's going on up there at the hospital? I
think people should certainly be asking questions and demanding better. I really do. I've said all the time, you know, before I was minister, I challenged and challenged and challenged what was going on. Would
you like to be back in
I would love to be back in. I would jump in like a shot if I had a decent chief executive with me.
But you didn't get on, so...
Exactly.
Right.
I didn't get on, one of us had to go.
And it was you?
Obviously. I was the one who got the sack, wasn't I?
Okay.
Right, which also brings me back, and this is the final one, I promise you.
That's right.
On health. Are we all right?
Yeah. My
written question 54. Oh, sorry, 50. I've moved on from that.
Right.
50 about... Actually, it wasn't mine. I'm pinching one. Again, it was the Speaker's, which is a really good one, but ties in with something that's been very close to my heart, as I'm sure, is the independent regulation of health. And surely all of this shows that we need that regulation. We need that independent oversight. We have to have it. And it is in the it's in the programme for government. And the last question that, as I said, that the Speaker asked, and was told that it was going to be in line with the time in the programme for government, but that's not till 2021.
Right.
I don't think we should be waiting, particularly, hang on, the Chief Minister confirmed his support in Hansard on the 18th of October 2016 that he would support it, subject to West Midlands having finished their reviews to avoid duplication. They finished their reviews.
And none of these came up in that?
Yes, they did.
And they just haven't been acted upon?
That's another question that I've asked a question on all the things that are still outstanding, and there's not enough time to collate all that. That'll come out as soon as possible. But when you put it all together, and West Midlands were consistent in their reporting of lack of governance. What does all this point to? Lack of governance.
More questions.
Absolutely more questions. But don't get me wrong, I am not blaming the Minister, David Ashford, because ministers are told not to interfere with operational issues, which this is. Chief Executive is in charge of the operational issues in the department.
So even when you were the minister, you wouldn't have been able to get in there because you'd have to go through your chief executive. And you did. And
of course I went in there. I had an office in there so people could talk to me.
Okay. Well, if you get back in, I'd be interested. But anyway.
I would doubt that very much if I would get back in.
Thank you very much on that. And we've got more to do, but thank you on that.
We have, and I hope we can talk again because there'll be more, I'm sure, on this one.